So we're doing these segments to answer some of the most commonly asked questions from patients around total knee replacement surgery, also known as total knee arthroplasty. These are the questions that come up all the time among patients in my clinic who are considering going through with a total knee replacement. Here are some of the top questions I hear from patients on the surgery day itself when going through a total knee replacement. How long does the surgery take? Surgery typically takes around 1 hour or less. Will I be awake or asleep during surgery? So the answer to this question will depend on the type of anesthesia used for your surgery. With a general anesthetic, you will be completely asleep during the surgery, but with a regional anesthesia, either a spinal or an epidural, you can choose to be awake for the procedure or somewhat sedated. Most patients in this situation choose to be sedated enough to sleep through it, even though they're not technically under a general anesthesia. You will meet with the anesthesiologist prior to the surgery who can discuss these options with you and decide on the best option for you based on both your medical history and your individual preference. What kind of anesthesia is safest for me? So again, this is a question you'll discuss with the anesthesiologist prior to the surgery. There are advantages to both general and regional anesthetics, and this will depend highly on your individual preferences. For example, one of the advantages of a regional anesthesia is that it has less impact on the heart and lungs than a general anesthetic, so it's often considered safer for people with cardiovascular or respiratory conditions. But oftentimes, patients prefer to be completely asleep during the operation, in which case a general anesthetic might be a better option for you. Will I need a Foley catheter or a breathing tube? So almost no one requires a Foley catheter for either a total knee or a total hip replacement. The requirement for a breathing tube, also called intubation, depends again on which method of anesthesia is utilized for your surgery. General anesthesia requires a breathing tube. A regional anesthetic typically does not. Do you use a robot to do the surgery? Yes, I use a robot for every single one of my knee replacements that I perform. In my opinion, the use of robotic systems has been one of the greatest, if not the greatest advancement in total knee arthroplasty over the past 20 years. But remember, the robot doesn't actually perform the surgery. That's still me doing the operation. The robot allows us to create an intraoperative 3D model of your knee that maps your individual anatomy in real time during the surgery. This allows us to plan implant positioning with extreme accuracy and adjust on the fly based on soft tissue tension, bony anatomy, and your unique wear pattern created by arthritis, minimizing the risk of over-resection or imbalance. For patients, this translates into better early functional results and improved long-term implant survival. You're walking and driving sooner, getting back to work faster, and returning to recreational activities like golf, tennis, and skiing with a higher level of trust in your knee, and this is the stuff that matters. What do you use to hold the knee in place? Do you use cement? So most total knee replacements that I perform are with what we call press fit or non-cemented implants. The undersurface of the components are coated with a specialized material called porous tantalum or trabecular metal, which is a sponge-like structure that allows for bony ingrowth into the implant. This allows for excellent long-term fixation without the need to use cement to hold the implants in place, and this is my preferred option. What will I feel when I wake up from surgery? In most cases, patients are quite groggy and drowsy, especially after a general anesthetic, but in most cases, very comfortable with minimal pain. As the spinal or anesthetic starts to wear off, it's normal to start feeling a little bit of discomfort, tightness, or pain around the knee. At this point, you'll be given either IV or oral medications to manage this. Additionally, we now routinely use long-acting local anesthetic agents, Exparel as an example of this, which we inject into the knee joint and the soft tissues around the knee to help provide improved pain control for a few days after surgery. How soon can I eat, drink, or go home after surgery? So you'll be allowed to eat and drink within about an hour or so after surgery. In terms of going home, that'll depend on both your individual preference and also how you do with your initial ambulation. Some patients prefer to get home as soon as possible after surgery, while others prefer to spend the night in hospital. Both options will be available to you. A physical therapist will come and see you in your room, typically within about 2 hours of your surgery, to help get you up and out of bed and start walking. Once you've had a chance to walk comfortably and feel confident enough to head home, you'll be cleared for discharge. If you're considering a knee replacement and want to know whether you're a good candidate, check out some of our other videos and give us a call if you'd like me to walk through the process with you in person.